Some parents feel that the child is going to forget about it. They're young. One, it didn't impact them very much. Two, they're going to forget. And if we pay attention to it, it actually becomes worse. That point of view is a more behavioral view. And one of the things that I believe I kind of touched on at the very beginning, trauma and the symptoms and the way it impacts a child will improve. And the point of intervention is when the symptoms have not actually decreased after a few weeks or a few months. If the symptoms have not decreased, that means it's time to get a specific trauma treatment. From having worked with adults as well, since I work with a lot of adults, I can tell you they remember vividly everything that happened to them from age 2, 3, 5, 11. The memories remain, the impact remains. And that's having worked with a lot of adults. They don't forget it, it doesn't go away. And one of the points that is important in trauma, it predisposes them and it sensitizes them to the future traumas. So somebody who is traumatized and maybe the first exposure, they don't develop PTSD. By the time they are exposed to a second, third, fourth, they're definitely traumatized, and the impact is much more than it would have been if they had got treatment for the first one, because you would be dealing with a healthy child. So parents, I want to caution you that children will never forget. But the trauma is registered in the body, and leaving it, even with, leaving it won't change anything. What it does is predisposes them to actually becoming more traumatized by future exposure. And the fact is, there will be car accidents, there will be dog bites that I treat a lot of children for. So all the future traumas will actually have much bigger impact if that earlier traumas are not addressed. So please find and seek a professional and do address these traumas.